Parliament has this evening passed the controversial HIV/AIDS Prevention and Control Bill 2010 without any amendments to the contentious clauses that criminalizes attempted and intentional transmission of HIV. Clause 41 hands a 10-year jail for a person convicted of intentional transmission of HIV, while Clause 39 provides for 5-year imprisonment for attempted transmission of HIV.
We are criminalizing women and going to put them in jail without the partner going for testing. So I think this clause is actually taking us back centuries. It's taking us back when all the progress that we have made in fighting this pandemic is going to be ruled out by this clause. This clause should have been amended. We are criminalizing people who are having consensual sex.
The ministers have told us that they are against the bill, especially clause 41 and 39. But I'm just hearing the minister here congratulating Parliament for having passed a very good law. So I leave this place not sure of what exactly the ministry is up to.
It is difficult to have a legislation that satisfies everybody. Their concerns will be taken into account, but all in all I would say that this is a positive legislation that is going to support work against HIV.
Though the bill has also created a trust fund to cater for the treatment, testing kits, counseling and research of HIV/AIDS, activists are asking the president not to assent to it.
It increases the capacity of Uganda to manage the epidemic instead of permanently relying on support from outside countries. Secondly, it increases the capacity of Uganda to do research on this epidemic. And thirdly, it reassures our people that they will be able to get that treatment.
And since the president assented to the East African Community HIV and AIDS Act, which is a very good law, we are looking up to him to revisit this bill before he assents to it, so that he helps us get a good law that is going to take us as a country to realize what we want to realize for citizens of this country, for women and girls in this country, for the vulnerable women.
Can we get some money to mitigate the money that the donors are likely to cut from us?
State Minister for Finance Aston Kajara put up a spirited fight about the fund, but was defeated by the majority MPs in the House who think there should be a special fund to fight the pandemic.
We are saying that we rationalize because government spends according to the money they have. So if you attach money from source from the Revenue Authority, before it goes to the consolidated fund, before government can attend to priorities, because every year you lay out priorities, funding for roads, funding for electricity, funding for education, for health. So this money, if it does not come, that means you are distorting the government prioritization program.
Honorable Aston Kajara very well knows what we've been doing, and we've been talking. And we even just actually told even the Minister of Health to liaise with his colleagues in the Ministry of Finance.
It has to be revisited so that at the end of the day, we come up with a fund that is going to be comprehensive, that is going to be transparent, and that is going to be free from manipulation and corruption that we see in this country.
If the president assents to the bill, 2% of the taxes accrued from beer, spirits, water and other bottled beverages will be sent directly into the fund that will be under the Ministry of Health. The bill seeks to prevent, control and reduce the transmission of HIV in Uganda. Agnes Nandu.